Well, of course, all of this follows the, I suppose, disappointment on Sunday night with the news that the efficacy rate of the AstraZeneca vaccine was not what we had hoped for. Professor Willem Hannekom is the director of the Africa Health Research Institute. Professor, good afternoon to you. I mean, it was a big disappointment on Sunday night. The question now, of course, is whether or not government's able to kind of pick up the ball again. We need vaccines that actually work.
Yeah, Stephen, I'm actually happened and how this has been handled within South Africa. We want to get the best product out to the people who need the vaccine. And it would have been irresponsible to just move forward without thinking very carefully about what has happened. And the evidence from that smallish studies that was done in South Africa is pretty clear that we should not be using the AstraZeneca vaccine, at least until we know that this vaccine prevents severe disease. It showed that it does not prevent mild to moderate disease. These are really about preventing severe disease. And the vaccine that is now going to be rolled out, the Johnson & Johnson vaccine, has been shown in South Africa where the variant that has emerged here is prevalent, that it does prevent severe disease. So it's the right decision.
It's also, I mean, it's such a complicated decision. I think one of the big factors with this is whether or not it is safe to have more than one vaccine against COVID-19. And the people I've spoken to seem to think so long as the vaccines are safe, and they're all safe from what we know, well, then it would actually make sense. I mean, if the AstraZeneca vaccine may offer you some protection, take the AstraZeneca vaccine. If another one comes along that's better, take that as well. Is that the wrong approach, or is there something in that?
I think that is a very valid discussion to be had, that there may be some protection still from the AstraZeneca vaccine against severe disease. We just do not know at the moment. And I think we need to go about it very carefully to get that data. And I think they are ongoing to actually decide how to get to that answer of whether that vaccine would work. But if we do not know that that vaccine works against severe disease, it's the right thing to roll it out.
So the Johnson & Johnson vaccine is what we're really waiting for. We're hoping it'll arrive next week. There's a lot of research. The regulators need to do what they need to do. I mean, it would be nice, and I think the power of the image is really important, Professor. I mean, I get the sense that once we start to see our nurses, doctors, healthcare workers, cleaners, porters in hospitals getting some protection, and by which I mean the image of them getting injected to protect them against the virus, it's a really powerful image. I think it seems to be really important to kind of get that image out there.
Absolutely. We need to get the Johnson & Johnson vaccine out as soon as possible. Unfortunately, it's not approved by SAHPRA at the moment, so that process needs to be concluded. But in the interim, it can be used in a study setting, in a clinical trial setting, where we can also learn more about that vaccine. And we should roll it out as soon as possible. I think our healthcare workers have worked under incredible stress. And they deserve to be the first people to receive this vaccine as soon as possible.
I mean, obviously, the moment we start rolling it out, I think everyone agrees, and I think there's consensus that healthcare workers first should get it, second deserve it. The argument really starts after that, doesn't it? I mean, teachers are already asking for their place in the queue, taxi drivers asking for their place in the queue. In a strange way, vaccinating the healthcare workers is the easy part of this.
Yeah, I think it's a massive undertaking. It's going to be a massive undertaking to vaccinate 14 million South Africans. But I think the government's plan, which is in a staged approach, where we start with healthcare workers and then go to people at increased risk of getting the disease, and then going to the general population, because I think we want to protect against severe disease. We want to protect against severe disease and death. And those are the people that should get the vaccine first. It's going to be a massive undertaking, though, unlike anything that has ever happened in South Africa. But I think the planning is underway to get this done.
I mean, done right, it could be a good moment of national unity as well. Professor, I mean, the problem the government has, and I have huge sympathy with them, in a way, is because there's now an environment of, let me use this phrase, an environment of economic uncertainty. The virus has shown that it can mutate. The vaccines, the AstraZeneca vaccine and most of the others, were developed to fight against what was called the first variant. Now we have the new variant, and gosh, we've got to give that a proper name. But we have the new variant, and that means that, you know, the virus can mutate again. Now, you've got a position, a health department that has to try and make policy around vaccines at a time when the virus could mutate for a third time or a fourth time. There's nothing to stop it from doing that. It's actually what viruses do, I understand. Is it important then to do really what the department has been doing, to be as transparent as possible? If the scientists disagree, let them disagree. Let us know that they disagree and let us know why. How important is transparency in this quite complicated position?
I think it's absolutely critical, Stephen, and the transparency to date has been phenomenal. Not just that, it's been unlike ever in the scientific world in how quickly results have been released, even without them having been peer-reviewed, so that people can be aware of what is going on, and even also scientists to be aware, to guide how to go forward to get to the best answers. So I think transparency is absolutely critical, and communication, as the government, I think, has done a very good job to communicate during this COVID epidemic, to communicate continuously. I do think, though, that it's been a very difficult time, as you have indicated. We didn't anticipate this variant to emerge, and we didn't plan for it. But I think the plans that are in place right now are probably the best ones that we can have for the current situation.
Professor Willem Hannekom, do appreciate the time. Thank you, Director at the Africa Health Research Institute.